Hello folks! Have you been asked what type of diabetes you have or your loved one has? Or has someone mistakenly mislabeled the type of diabetes you or your loved one has? Keep watching to find out what to say and how to describe the two main types of diabetes. I've had type 1 diabetes for 42 years, raised 2 type 1 kids, and worked as a diabetes educator. And I have to tell you that when I get asked what oral medications I take for my type 1 diabetes, or that I should have watched my diet to prevent the diabetes I have, I kind of cringe on the inside. But I jump at the opportunity to do some on-the-spot education, so let's dive in. Please remember this is my experience and not medical advice. Type 1 diabetes is an autoimmune disease, meaning the body attacks itself, and that affects the pancreas's ability to produce insulin. It often develops in childhood. For example, I was diagnosed at 8. My 2 daughters were diagnosed at 18 months and 11 years old. And individuals with type 1 diabetes require insulin almost right after diagnosis, or the use of an insulin pump to manage their blood sugars. So basically, you wake up one day, your pancreas stops working and you need insulin. Kind of crappy. I remember my diagnosis. I had weight loss, I was irritable, I had unquenchable thirst, I was frequently peeing on the toilet. My mom would clean it off and it'd be sticky. Treatment for type 1 diabetes is basically insulin right away, a lot of education on nutrition, carbohydrate counting, and lifestyle. Monitoring your glucose with a glucometer or a continuous glucose monitor. On the other hand, type 2 diabetes is mainly influenced by lifestyle factors. It usually develops later on in life and is characterized by insulin resistance. This means the body still produces insulin, but it doesn't work effectively. Type 2 diabetes can often be managed with a healthy diet and exercise, but medication or insulin may also be necessary. The onset of type 2 diabetes is usually slower, and blood sugars can be mildly elevated for quite some time. So screening is very important during regular checkups with your doctor or healthcare team. The earlier it catches, the better. Treatment for type 2 diabetes, lifestyle changes, dietary modification, increased exercise with a focus on weight loss. Addressing issues like sleep apnea that can increase stress overnight and cause insulin resistance to worsen is also something to focus on. A variety of oral and injectable medication are now available for type 2 diabetes. However, sometimes, if uncontrolled for a long time, the pancreas can still stop producing insulin, and type 2 diabetics sometimes require insulin. As you can see, type 1 and type 2 diabetes are very different. However, they still cause increased blood sugar levels. And if not properly managed, both type 1 and type 2 diabetes can lead to micro and macrovascular diseases like heart disease, kidney damage, nerve damage, vision problems. However, with early diagnosis and treatment, many complications can be prevented. So it's very important to visit your healthcare team regularly to get screened for diabetes and to have follow-up if you have diabetes. Diabetes can be a silent threat, so knowing your numbers are crucial. It's also important to take your medications and or insulin, and as I always say, keep those blood sugars in range by monitoring your blood sugar frequently or using a CGM or continuous glucose monitor. If you or your loved one has been diagnosed with diabetes, remember that you're not alone. Support groups and educational resources are everywhere. You just have to get on the internet. So thanks for watching. Wishing you all healthy blood sugars in range. And if you've enjoyed this video, please subscribe and like the channel. Check out my last video here that talks about diabetes and managing sick days. Bye for now.